Welcome back to Houston Life. After months of being told nothing was wrong, one Houston woman says she finally found a care team who truly heard her.
Yeah, Melanie Camp takes us to the CLS Health, where collaboration between doctors is redefining patient care.
When you walk into CLS Health, you're not just meeting one doctor. You're stepping into an entire community of specialists working together.
It's actually pretty amazing. So Dr. Baba and Dr. Dwake decided about 2 decades ago that they wanted to have a practice that was provider-focused and patient-centric. And they wanted to be able to let the providers take care of patients the way that they see fit. And as long as the providers were happy, the patients would be happy, the employees would be happy, and we could provide good quality care in our community.
Dr. Hassam Isa is one of the founders of CLS Health.
We're owned by physicians, so it's basically my practice. Every physician's is his practice. It's not somebody who tells me what to do and what not to do. We do fight for the patient to get what he needs done.
That vision to keep medicine in the hands of doctors has grown across Houston.
Great. Susan, thanks for letting us in. Appreciate it.
So originally this was the flagship. And since then, we now have over 40 locations all over Houston. This is the largest one, and we're actually building several others. We'd like to have 14 like this around the city of Houston, and then some feeder sites that are, comprehensive care clinics at a smaller level. But it will allow us to take care of the entire community the best possible way. We like for our providers to live in the communities that they serve. That way they're taking care of the people who might be in their neighborhood or they may see at their local grocery store. But it allows them to really and truly focus on what matters to them. Good patient care, taking care of the community, and being happy, being healthy. So that's what we do here.
Sometimes patients with fever come to me with fever going on for a long time, and sometimes it's an infection, sometimes it's not. I'll notice that the patient has some arthritis, joint swollen, so usually to see a rheumatologist for that condition, you would need 2 or 3 months wait time. So I walk down the hallway to the rheumatologist, I talk to the MA, I don't talk to the doctor, and the MA says bring him in. So bring the patient in, they get seen right away and taken care of. That's more of an acute problem, cannot wait for 2 or 3 months. So the patients appreciate it, that it can be taken care of right away and addressed to the right people. So, and that's how you can take everything under one roof.
And sometimes that teamwork means catching something serious.
That's how Lily's life was saved.
Yeah, yes.
I was having a lot of abdominal pain for several weeks, maybe a couple months. I did go to the ER a couple times. They would do blood work and send me home and say that everything was fine. Obviously, I wasn't fine. I knew something was wrong. Both my sisters were with me through all this. My sister, she started making phone calls to look for a doctor that would take me. A lot of them would not take my insurance at the time. After making phone calls, we found CLS Health, and sure enough, they said, yeah, come on in tomorrow morning. Right away, came in to see Dr. Muhammad, and he was so caring, so loving, and I am forever grateful for that day. The look in his eyes of concern, the way a father looks at his child, He said, we need to take you downstairs now. He didn't hesitate, he didn't have to wait. I didn't have to wait to make an appointment in a week or two. It was at that same moment, we're going downstairs to the OBGYN, Dr. Harmouche. We went downstairs, Dr. Harmouche started checking me, and he said, yeah, we've got a problem here. He gave me some papers, and he said, I'll meet you at the hospital. We're gonna get you taken care of. And the next day, he did surgery. And that's when I found out, and I was diagnosed with uterine cancer stage 4. Broke my heart. The first thing that comes to your mind when you hear those words is, I'm going to die. I lost all my hair. I lost about 60 pounds. We did 13 rounds of chemo, 28 rounds of radiation within a year and a half, almost 2 years.
When you look at this picture here, you look pretty sick. And then to see you here now,
You just look radiant. You look so healthy and so alive. It's almost like this isn't the same person.
I look at myself also and I thank God, you know, every day that I get up and take my daughter to school, I go to work to see the blue sky, the clouds, the trees, like, God, you let me keep seeing this. I'm forever grateful.
Because of the community of physicians that we've built, those doctors can work together for one woman and to really save her life. And there's many stories like that.
Thank you so much, doctor. I'm forever grateful.
It goes back to one thing, and it's healthcare how it should be. It's our hashtag, it's what we stand by, it's what we talk about every day in administration, in our clinics, healthcare how it should be. It shouldn't be that hard.
My whole family comes here. My parents, my sisters, my best friend Mary, she comes here, so everybody's happy with CLS Health.
And if you would like to learn more about CLS Health or to connect with a provider, you can call 281-724-1860, or you can go online, cls.health.
And